So this is Niko Skievaski. He is the president and founder of Redox. Thank you so much for talking to me today. So start by telling me why you founded Redox. What was the problem that you saw in the industry that really needed solving?
Yeah, so it's self-serving, but I truly believe that getting access to the data and making the data liquid is a huge, it's preventing the industry from making progress in a number of different areas. So if we look at, humans use technology to become more efficient, and we're basically we're not able to use technology in healthcare because of the barrier of being able to get the data out of health systems and into these technology vendors. And so we see big vendors getting bigger because small vendors are kept out of the space. So the innovation in the industry is really encumbered by this barrier to entry. So as we start seeing data interoperability become more opened up, we should start seeing more innovative applications come to market. And it's the application layer that's going to take data, which is not interesting, and turn into information, which is interesting and actionable, and something that patients can actually use to figure out, what they should focus on with their care and actually become engaged in their healthcare. So the data liquidity, I think, is the sort of building block we need to make that killer app that's actually going to improve healthcare in a big way that we really haven't seen yet in the industry. So it's a building block that's necessary. It's a chicken or the egg situation. We're building the chickens or the eggs right now, and whatever comes next is this application that will be built on top of this data layer once we can get all of the data out of their independent silos. So the short answer to your question is this interoperability problem, I think, is one of the biggest problems facing healthcare.
So you briefly touched on the issue of patient engagement.
Yeah.
Why do you think patient engagement has been such a challenge? Why is this something that health systems have struggled with for so long?
Yeah, so there's a number of problems that will always be here. So patients and consumers we like the immediate sort of satisfaction things, and thinking about long-term future is not something that humans are very good at, which is why we have insurance in general, or why we have 401ks instead of just saving our money. So just valuing risk is not something that humans are interested in. And so as a young invincible, or a lot of the types of patients out there that don't have a chronic condition, it's hard for us to be engaged in care because we don't really have a reason to. Like, we're healthy enough, and then by the time you're not healthy, it's kind of too late. So patient engagement is really about how do we engage patients and keep them kind of thinking about prevention and being healthy when it's not a problem yet. On the chronic condition side, like diabetes and hypertension, these other things that are already a problem, you see patient engagement higher in a lot of cases because they have something that they're actually trying to solve for. And this is where we're seeing technology creep into that space more readily. So you have applications that can help engage patients in managing their diabetes, for instance. We work with Dexcom, which is a company that has an app and a continuous glucose monitor, and patients love it because it tells them, like, on real time what's going on with their glucose and how they can change their diet and their insulin levels to actually feel better and healthier on a day-to-day basis. But by the time you have a chronic condition, like, the holy grail is to figure out how to engage patients earlier so we can actually prevent a lot of that. And I think that's where, as we get more technology out there that can build engaging interactions for patients, can figure out how to engage someone like me who, I don't care on a daily basis about my health because I just generally live a healthy lifestyle, but who knows if something I'm doing is, the beers I'm drinking or the food I'm eating is causing some lingering problem. You could envision an application ecosystem that would engage me because it tells me, hey, that beer you drank took a day off of your life. And those sorts of models that would engage the young invincibles to actually to care more about preventative health. Other aspects are, can we actually pull the data out, give it to the patient so they're empowered, but then let the patient receive monetary benefit by sharing that data. So, like, data brokerage type models where you can get a patient engaged in their care because they get paid by their insurance company, or they get paid by pharmaceutical companies who might want that data for research. There's different methods like that where we can think of economic incentives to actually incentivize the young invincibles, the not sick people, to be more engaged in their care.
Fair enough. That sounds actually kind of cool and amazing, and I think I definitely would not drink that beer if it were going to take a day off my life.
And with machine learning, they can literally put you in a model, and the more we have about our quantified self, they can put it in a model and get fairly accurate from a statistical standpoint on what's your length of life. And so you pick up smoking, you can see it decrease, right? If you plan to, engage in risky activities, you can see it decrease. Exercise, you can see it increase. And I think that's getting it down to that level of actionable sort of data, I think is really important to engaging people, and it all goes down to what data can we get out, both from the clinical side as well as the behavioral health side and the quantitative self, kind of all coming together to feed into that model.
What about communication? Can we communicate better with patients than we're currently doing?
Yeah, we can. We can communicate better with patients, but I don't want to talk to my doctor. Like, it doesn't really help with me being engaged if I have a tight relationship with my doctor. For the healthy people, and this is getting into the personas of like the types of patients. For healthy young people, seeing their doctor, like, it's like seeing my auto mechanic. Like, I don't want to go unless there's a problem. I don't want to build a relationship. For people who have chronic conditions, absolutely we can communicate. We need to communicate better with patients. We need patients to better understand how the treatment that they're receiving is going to turn into health outcomes. So really on those types of personas, your point is well taken, that absolutely communication is key. But for the healthy folks, it's like communication isn't as important because it's not an acute problem. So yeah, I'm not sure what audience we're trying to kind of get at with this, but like it's kind of such a broad topic because we're all patients, right? So there's so many different facets and different ways to think about it. And actually, I think that's a good point too, is that we have to think about patients in a persona and not as a sort of one-size-fits-all. So solutions need to be tailored differently. Care delivery needs to be tailored differently. So when you walk into a clinic, there should be a fundamental difference between someone who's at the clinic for an annual checkup versus someone who's there for a cold versus someone who's there to get a medication refilled, and they have to go every single month because they just have to do that to keep up with their medications. Those are very different use cases. There are different jobs to be done, right, to use a modern lingo, but the actual experience going into the setting is the exact same for every patient. So we could change the actual care delivery models to be tailored towards personas in a different way that could engage different patients based on what they need. So the person who's there for an annual visit, you really want to be in and out and be like, everything good, and I'm out. The people who are there for smoking cessation need time to sit down, and they need to, they need counseling more so. It's a very different experience than, cough to the left type experiences.
Fair enough. So how do you think that healthcare is going to be different in the future, 5-10 years down the line?
Yeah, well, so we are seeing more niche providers come out to deliver different experiences for different types of patients. Mm-hmm. So I love looking at who are the small people who are actually transforming the way that care is delivered on the fringes. So the big regional health systems, they're going to keep doing what they're doing, and they're never going to change. They might start specializing more, but on the fringes, I think, is what's really interesting. And so on one extreme, you have companies like Forward or One Medical who are changing the way that care is being delivered for the very healthy people. It's like those are the tech nerds who aren't really unhealthy who use those sort of services. And they get a concierge experience. They get the convenience that sort of that type of persona is looking for. On the other end of the extreme, you have companies like Iora who are doing care delivery, but oftentimes in the sickest populations, in Medicare Advantage, in unions, and they're looking at how do we actually engage patients who need to be actively pulled into the healthcare system, who aren't engaged right now, but there's tremendous cost on the line if they're not. So it's a very different way of delivering care. And by specializing on those types of personas, I think that we can start to see really different care delivery models start to innovate. To figure out what type of patient they are requires a lot of data, and both actual clinical data, but also what is the patient doing on a day-to-day basis, right? There's a lot of social determinants that go into that. So I think this focus on what happens outside of the clinic, outside of the hospital, is also something that we're going to see transform healthcare, because 99% of our lives were not in the hospital, and that has so much more impact on our health than what goes on inside the walls of healthcare delivery.